Dr. Gupta. And next we have Dr. Susan LeBlang. Suzanne is the Director of Clinical Relationships of the Focused Ultrasound Foundation, where she interacts with preclinical and clinical researchers around the world to expedite clinical adoption of this novel technology. She has performed hundreds of focused ultrasound procedures and is also a breast cancer survivor herself. Dr. LeBlang?
Thank you so much for the introduction. So I'm very excited to talk to you about this technology called Focused Ultrasound. And the Focused Ultrasound Foundation puts out a State of the Field report every year. And you can see the numerous ways that focused ultrasound can affect pain and help treat pain. So bone metastasis, as you can see here, already has regulatory approval. And then we can also treat other causes of pain like said arthritis. Now, how does this work? Focused ultrasound, it sounds very complicated, but it's really not. So do you remember when you were young and you used to go outside with a magnifying glass? You can make the sun's rays converge at a focal spot on the leaf, and it will actually catch on fire. You generate very high temperatures. But if you put your hand in between the magnifying glass and the leaf, nothing will happen to your hand. So how can we do that with focused ultrasound? Instead of using the sun's rays as the energy source, let's use an ultrasound beam, just like the ultrasound you use when you're pregnant or when you're getting your gallbladder looked at. So let's see what happens when we can do it inside the body. We can put a patient inside a focused ultrasound machine. You can see the beam here coming down from the bottom, and we can use the MRI scan or ultrasound to guide this to a lesion inside the body. And when we direct that beam there, we can generate very high temperatures and ablate tissue. But all the tissue in the interim is completely left intact. So it's a very interesting technology that we're really, really excited about in the field of medicine. So how can we use this to help breast cancer patients that have bone metastases? Bone is the third most frequent site of metastatic disease in breast cancer patients, most common cause of cancer-related pain. Hundreds of thousands of patients suffer from bone metastases every year. Many of them end up getting external beam radiation therapy, and not frequently, only a third of them will not respond to that. So MR-guided focused ultrasound can actually offer numerous advantages compared to conventional external beam radiation. Number one, the pain relief happens almost instantaneously within 1 to 3 days, whereas radiation therapy can take a few weeks. You only need one session with MR-guided focused ultrasound to make the pain go away, and oftentimes you need multiple sessions of external beam radiation. There are multiple side effects with external beam radiation and very few with focused ultrasound, and it's repeatable because we don't use radiation, right? So let me show you an example. Here's a 36-year-old breast cancer patient. Her VAS score, which is a pain score, was 10, which on a scale of 1 to 10 is the highest. So here you see part of the ileum here, and you see a enhancing lesion, which is causing tremendous pain. After the focused ultrasound procedure, there's a black band here along the surface of the bone, and the nerve resides along the surface of the bone, and that nerve causes the pain. So what we're actually doing is ablating or killing the nerve so it won't send those sensory signals to the brain to tell you you have pain. So again, the beam comes down from the bottom of the table. We focus it right to the area. And then before the procedure, you can see that there's this lytic lesion in the bone. That's the tumor in the bone. And what they've also found is that the focused ultrasound procedure promotes healing. You get recalcification of the area to make the bone strong again. So number one, it gets rid of the pain, and it also tends to help heal the bone. And randomized control trials proved this, and these are just some data in case you wanted to look up the results of this randomized control trial that led to the FDA approval. How else can we help breast cancer patients with focused ultrasound? Well, a lot of patients get breast cancer when they're older and they already suffer from degenerative disease. And patients are living longer because our breast cancer treatments are so good. So patients such as myself, I'm now 5 years out, are living 5, 10, 20 years or a lifetime and being cured, and then will suffer from arthritis. So one type of common arthritis is facet degenerative changes, where the joint more towards the back of your spine rotates and causes degenerative changes. And the current standard of care treatment is RF ablation, where you stick a needle right next to the joint, as you can see here, and you ablate the nerve. Again, you want to kill that sensory nerve. So think about how we can do this now non-invasively with focused ultrasound. Oops, sorry. So again, here's RF ablation, where they stick the needle into the back to get to this little yellow nerve right here called the medial branch nerve. So now you can picture with a focused ultrasound machine, we can do this completely non-invasively. We put an ultrasound transducer on the back, shine the ultrasound beam right to the same exact location where the medial branch nerve is, and ablate the nerve that way. In this upper picture here, you can see the damage to the soft tissues caused by RF ablation. But in the bottom picture over here, you can see that the focused ultrasound machine only ablates the nerve exactly where it resides, very close to the spine. So those are two areas that are in clinical use right now. I wanted to just give you a little teaser as to what's coming up on the pike. Many patients suffer from disc disease, breast cancer patients, non-breast cancer patients. But there's ample preclinical data now that's investigating ways that focused ultrasound can actually stimulate collagen production inside the disc to make it strong again, and also deliver drugs in a targeted fashion in a non-invasive way to the disc space to help alleviate pain and or promote more collagen. So you can put different drugs inside these particles, and then you can use the focused ultrasound machine to release the drug in the disc space. And then that drug can affect the disc space right there and nowhere else in the body. So it's like a targeted drug development tool. And also it stimulates collagen production. So we're very excited about this area and hope to bring it into clinical research soon. So I hope from that short talk, you know a little bit more about focused ultrasound. Our website is listed here, fussfoundation.org. And again, we're using it clinically right now for pain palliation from bone metastases and for degenerative changes in facetogenic back pain. So thank you for your attention.
That's wonderful, Dr. LeBlang. Thank you so much. And is it possible that the ultrasound beam is able to reach nerves anywhere in the body? And also, can you just describe to us again how it's not dangerous to healthy tissue?
Sure. Thanks for the question. So it turns out that bone absorbs the energy from the ultrasound beam 20 times as much as soft tissues. So if you think of arthritis, any nerve that's adjacent to a joint is the one that causes the pain, which makes it especially attractive to treat any nerve along a joint. So in addition to the facet, research is ongoing with looking at nerves around the knee, an SI joint, and we look forward to doing more studies. But in theory, we can ablate any nerve that's adjacent to a bone. Having said that, one area that we're a little bit cautious about is the spine. And unfortunately, a lot of breast cancer metastases occur in the vertebral bodies. That may be a little bit harder to get to, but a lot of technological advances are being explored to try to reach that safely. And again, because the bone absorbs so much heat, any nerve along the bone can in theory be ablated with this technique. Mm-hmm. And in terms of it not damaging tissues along the way, if you have, let's say, 200 beams coming out from the ultrasound transducer to meet at that focal spot, you can think of it that each beam by itself is not strong enough to do anything. Only where the beams converge at a focal spot will they converge and actually heat the temperature to that 60 degrees Celsius, which is enough to kill anything, just like RF ablation or other modes of heat therapy that's used. So again, each individual beam is not strong enough, but where they converge or where you can create that physical effect, that's where you get the heat. So anything along the beam path is safe.
Wonderful. A viewer is asking very specifically about focused ultrasound in the treatment of pancreatic cancer. And then on that note, what are the most exciting new areas that focused ultrasound is looking at to alleviate pain?
So yes, thank you for that question. And the Focused Ultrasound Foundation investigates research and clinical adoption of focused ultrasound with a wide variety of disorders. And pancreatic cancer is one of our main focuses. But I'm going to actually make an analogy between pancreatic cancer and breast cancer, because I want the audience to know that this is not just applicable to bone pain for metastatic disease or just the degenerative disc disease. But we actually have about 9 or 10 clinical studies going on right now. And whatever I say for breast is applicable to pancreas right now as well, where we can either do thermal ablation of the primary breast cancer, so a way to non-invasively destroy the breast cancer without doing surgery like a lumpectomy or a mastectomy. We can do targeted drug delivery. So we can actually put medicine inside a small smart particle, inject it, and then we can make it release just in the area of the breast tumor by letting the focused ultrasound beam open up those smart particles to deliver much more medicine right to the tumor and avoid systemic toxicity to the body. Again, same thing with pancreatic cancer. We can also use radiation sensitization, which is now in a clinical trial, where if we do focused ultrasound to the tissue, it primes it up so that you can maybe use less radiation and get less side effects and have the radiation be more efficacious. And one last clinical trial that's really exciting now is for patients with HER2-positive brain metastases, where we're doing targeted drug delivery across the blood-brain barrier. So normally the blood-brain barrier, just to make it super easy, is we can't get medications across this blood-brain barrier into our brain for Alzheimer's disease, metastatic disease, but focused ultrasound can open up the blood-brain barrier in a very targeted area. So we can give Herceptin, open up the blood-brain barrier where the brain metastases is. We can actually watch and tag the Herceptin with a radio-labeled pharmaceutical and watch how more medicine is getting into the brain tumor itself where the metastasis is and not into the rest of the normal brain. So again, we're attacking cancer on multiple fronts with multiple mechanisms of action of focused ultrasound, and all of that is applicable to breast cancer and other cancers like pancreatic cancer.
It's amazing. Wonderful.